hi there, folks. Welcome to the program. This, of course, is Stinchfield, the podcast. I want to talk about what I think amounts to a CDC admission. They changed the guidelines now for isolation. Heck, you don't need to stay home for 5 days anymore. Now, 24 hours after being fever-free, you can go out in the public and do whatever you want. Lo and behold, this is exact same guidelines for the flu and a common cold and everything else. The CDC also, there's now contemplation to change the VAERS system name. This is the Vaccine Adverse Event Reporting System, to a new name. What is this about? And what is Bill Gates' involvement in all of this? The state of SARS-CoV-2. My guest is Dr. Peter McCullough today. I don't know if there's anybody who's more of an expert on this stuff than him. I can't wait to break it all down with him. So with that, let's get the show started. Don't forget, though, folks, twc.health/Grant. They're the sponsor of this program, and I'm so honored to be involved with them. twc.health/Grant. Get all the medication to protect yourself from all the things we're talking about today. Have that kit on hand. Use promo code GRANT for 10% off. All right, folks, here we go.
Uncensored and unapologetic. This is Stinchfield. Here's your host, Grant Stinchfield.
All right, as promised, I told you my friend Dr. Peter McCullough would be with us. Dr. McCullough, it's great to see you again.
Thank you.
So many things to talk about here. I think I want to start with what I think amounts to an admission. Why all of a sudden now are we changing isolation from 5 days to the typical 24 hours after being fever-free? What's going on here?
The CDC is backpedaled progressively. You probably remember people being in quarantine for 2 weeks. All of that was a giant overreach. It was an assumption that the virus was much different than really what we knew it was to begin with. It's a beta coronavirus. There were 4 of these that caused the common cold that was known for by decades. This one was modified in the Wuhan Institute of Virology, but it didn't mandate or call for anything what we would have done for the common cold. And that is, once we're fever-free and symptoms are controllable, we return to normal activities. Patients test positive, Grant, for months afterwards. We cannot rely on a PCR test. We have to rely on clinical symptomatology.
So this is interesting, Doc, because I went back and looked at some of the data for hospitalizations during the COVID pandemic. And I go back to 2022, January of 2022, they said they had about 3,000 hospitalizations per 7 days. This is CDC data. Then lo and behold, all of a sudden, April, which is not that far later, of 2022, it plummets to 200. I think something happened there. I think that something happened with the testing. Something was not legit. What was happening with those numbers that we would see such a dramatic drop in just a few months?
It's just a change in testing practices. What we've learned is that the only people who need a test are people who are acutely symptomatic with suspected COVID pneumonia, not to test people with orthopedic problems or coming in for elective surgeries and procedures. Hospitals over-tested. That inflated the case count. It detained patients, separated from their families, and it was all wrong policy.
All right, so this is going way back now when we had, case numbers that were, just thousands upon thousands of them. I now believe that the flu was getting lumped in with this. We had basically 0 cases of flu. Do you think that's the case?
The original CDC created PCR tests that the laboratories adopted, including ours, by the way, in Texas, the laboratory-derived assays, they could not distinguish between influenza and the flu. So when people came in, particularly elderly people, if they were just tested for COVID, they would be positive, and indeed they actually had the flu. So we'd actually have to test for flu and COVID, then realize that COVID was false positive. That wasn't done. So my hunch is, like yours, is that particularly our senior citizens with influenza were mislabeled as COVID. And Grant, that means they were isolated, separated, and they weren't treated for influenza. They were treated for the wrong illness.
And people died because of that.
They did. And, even to make matters worse, in New York State, they were returning sick people back to the nursing homes. And now Andrew Cuomo is being called to Congress He's being called up. We predicted this in our book, Courage to Face COVID-19. He's not going to get away with this. This was terrible policy. Our seniors were mistreated. And boy, you're right. Some of them died, sadly, for no reason.
When you think about all of the lockdowns, all the mandates, all of the life-changing things we were put through from what I dub now a tyrannical government, and I don't like to throw tyranny around easily. I think conservatives sometimes throw that term around too easily, but this was tyrannical what we went through. No one talks about this idea that flu cases were lumped in there, and I think the CDC's own website shows that there were like virtually 0 cases of flu. That's impossible.
It's true. Influenza is always there. It accounts for about 15% of all upper respiratory tract infection hospitalizations through the winter. A paper from CDC 1040 showed that again last year. So we know that's consistent. It just can't go to 0 in a year. The influenza vaccine, poorly effective. We treat it early. We've got, I think 3 drugs, including 1 IV drug we could treat early. Influenza, the reason why people can die with influenza is they get a secondary staph pneumonia. So we have to treat with antibiotics in the hospital. But influenza, again, just like COVID, treatable early has to be detected, and we have to move quickly. The point is all of this should be shifted to the outpatient world, not the hospital.
All right. And